Erectile dysfunction, or ED, is a common issue for men. It affects men of all ages, ethnicities, and backgrounds, making it a universal concern that transcends cultural and social boundaries. ED involves difficulty getting or keeping an erection firm enough for sex. This can be due to a variety of factors, including physical, psychological, and lifestyle-related issues. Many men experience this at some point in their lives. It's important to understand that occasional difficulty with erections is not uncommon and can be influenced by stress, fatigue, or temporary health issues. Despite its prevalence, ED can be misunderstood and even embarrassing to discuss. The stigma surrounding ED often prevents men from seeking the help they need, leading to unnecessary suffering and a decrease in quality of life. This essay aims to provide a clear and comprehensive understanding of ED. By breaking down the complexities of this condition, we hope to empower men with the knowledge they need to take control of their health. We'll explore its various types, causes, and the impact it can have on relationships. ED can stem from physical conditions like cardiovascular disease, diabetes, and hormonal imbalances, as well as psychological factors such as anxiety, depression, and stress. We will also delve into the available treatment options and the importance of seeking help. Treatments range from lifestyle changes and medication to therapy and surgical interventions, each tailored to the individual's specific needs. Understanding ED is the first step towards effectively addressing it. Knowledge empowers men to make informed decisions about their health and seek appropriate treatment. By increasing awareness and knowledge, we can remove the stigma surrounding this condition. Open conversations about ED can lead to better support systems and more effective management strategies. Let's break down the barriers and shed light on this common health concern. Together, we can create a more supportive environment where men feel comfortable discussing their health issues and seeking the help they need. By fostering a culture of openness and understanding, we can improve the overall well-being of men everywhere. Erectile dysfunction is not a one-size-fits-all condition. It is a complex issue that can manifest in various forms, each with its own unique set of characteristics and underlying causes. Understanding these different types is essential for anyone looking to grasp the full scope of this condition. It presents in various forms, each with its own set of characteristics. These forms can be broadly categorized into primary and secondary erectile dysfunction, as well as situational and generalized erectile dysfunction. Each category has its own nuances and implications for treatment. Understanding the different types of ED is crucial for proper diagnosis and treatment. Without this understanding, it can be challenging to identify the most effective treatment plan. This knowledge helps healthcare providers tailor their approach to each individual, ensuring that the underlying causes are addressed. One type is primary ED, where a man has never been able to achieve or maintain an erection. This form of erectile dysfunction is relatively rare and is often linked to congenital or developmental issues. It can be particularly challenging to treat because it is usually rooted in long-standing physical or psychological conditions. This is less common and often stems from a physical or psychological condition present from a young age. Conditions such as hormonal imbalances, nerve damage, or severe psychological trauma can contribute to primary ED. Early diagnosis and intervention are crucial for managing this type of erectile dysfunction effectively. Secondary ED is more prevalent. Unlike primary ED, secondary ED occurs in men who have previously had normal erectile function. This type of erectile dysfunction is often easier to treat because it is usually linked to identifiable and often reversible factors. Men with this type experience ED after a period of normal sexual function. This can be particularly distressing because it represents a change from what was once a normal and healthy sexual function. The onset of secondary ED can be sudden or gradual depending on the underlying cause. This often points to underlying health issues or lifestyle factors that develop over time. Conditions such as diabetes, cardiovascular disease, and obesity are common culprits. Lifestyle factors like smoking, excessive alcohol consumption, and lack of exercise can also contribute to the development of secondary ED. Another distinction is between situational and generalized ED. These categories help further refine the diagnosis and treatment approach. Situational ED is often linked to specific circumstances, while generalized ED is more pervasive and persistent. Situational ED occurs only in specific situations like with a new partner or under stress. This type of ED is often psychological in nature and can be triggered by anxiety, stress, or relationship issues. It is usually temporary and can be managed with counseling or lifestyle changes. Generalized ED, however, is not confined to particular circumstances and is more pervasive. This type of ED is often indicative of more serious underlying health issues and requires a comprehensive medical evaluation. It can be caused by chronic health conditions, medications, or a combination of factors. In summary, understanding the different types of erectile dysfunction is essential for effective diagnosis and treatment. Whether it is primary or secondary, situational or generalized, each type has its own set of challenges and requires a tailored approach. By recognizing the specific characteristics and underlying causes of each type, healthcare providers can offer more targeted and effective treatments, improving the quality of life for those affected by this condition. The causes of ED are diverse and often interconnected. They can be broadly categorized into two main categories: psychological and physical. Psychological factors encompass stress, anxiety, depression, and relationship problems. These emotional and mental states can significantly impact sexual desire and performance. Physical causes include conditions like heart disease, diabetes, obesity, and hormonal imbalances. These underlying health issues can affect blood flow and nerve function, essential for achieving and maintaining an erection. Lifestyle factors such as smoking, excessive alcohol consumption, and drug use also contribute to ED. These habits can damage blood vessels and nerves, impairing erectile function. The mind plays a powerful role in sexual function. It's not just about physical readiness. Mental and emotional states are equally crucial. Psychological factors can significantly contribute to ED, often intertwined